about social care. It's really important in trying to sort out the NHS. We spend $200 billion a year on the NHS, and people see one part of it. Social care is a really important part of this equation, and it's totally ignored as far as I can see. Back in January, and I got this off the government website yesterday, back in January, the government set out its ideas to transform social care. New reforms and independent commission to transform social care is the blazing headline from January. The government, according to this, sets out immediate investment and reforms to improve adult social care. They say our package of support will deliver the government's plan for change by helping to keep older people out of hospital and living at home independently for longer. It goes on to say thousands more disabled people to receive home adaptations as government improves technology and data sharing between the NHS and social care. Now, crucially, it also says Baroness Louise Casey is to chair an independent commission into adult social care. Thousands more people with disabilities will be supported to remain in their homes, and it goes on to talk about the various things they want to do. Now, fast forward to where we are now. In April, the government still has not held a single, not one, all-party meeting on social care. 4 months on from Wes Streeting's announcement of the commission aimed at building agreement between the main parties. They had talks which were scheduled for February the 26th. They were then postponed. The Lib Dems then said, right, we'll clear our diaries to make sure that we can reschedule these meetings, but no meeting has been agreed. Doubts now being expressed. This is the Daily Mail about Labour's promise to overhaul adult social care. As I said, the cross-party talks have yet to get off the ground. Wes Streeting himself has warned that if you don't reform social care, many more elderly people will be left without the care they need. The NHS will be overwhelmed, and yet nothing is going on. Joining me now is Joyce Pinfield, who's Vice Chair at the National Care Association and campaigner at Providers Unite. Good morning to you.
Morning.
This is so critical, isn't it? If we are truly going to reinvent the National Health Service and social care system, which we have to do, we desperately need to do, as people get older, we have to have exemplary social care. Without that, the NHS cannot possibly continue to exist in its current form.
Oh, absolutely. We're just fed up within social care of successive governments. This isn't just a recent problem. This has been a problem that's been going on for well over 20 years. And so it's been going from crisis to critical. And now we really are at crunch point due to, the increased costs, many more people wanting care. And of course, people now need far complex care needs that we've got to try and look after. When I first went into social care over 25 years ago, many people came into care homes for social reasons. Now we are more like mini hospitals. But this is where we really can help out the NHS. We have been upskilling our staff so that we can look after more people in nursing homes, care homes, and indeed in the community, that more people can be looked after in their own homes or in a residential care setting, therefore preventing people going into hospitals and blocking up the NHS. Of course, we can also help the NHS by solving that bed blocking problem. But successive governments, and then we came into this latest government promising a national care service. We then, in January, as you state, it was announced Baroness Casey was going to do a report. But unfortunately, that report isn't going to even have phase 1 until next year, and phase 2, which is the more sustainable part of that report, until 2028, which after all, that's only a year before the next election's due. So are any parties going to be interested in working together at that point to really sort out social care when we are really at this critical point at this moment in time? we're still waiting to see what happens at during this month with the increase in minimum wage, the increase in the national insurance, which has really hit all care providers, whatever they are, whether they are providing care, residential care, community care, learning disability care. It has really hit every single provider looking after our vulnerable elderly people and the younger adults that need care.
There was a great quote in one of the articles I read saying that what is going on behind the scenes is the ministers have essentially filed this on the it's far too difficult to actually even bother to cope with pile.
Oh, definitely. It's definitely in the too difficult pile. There's no political ambition, it appears, from parties to even try and solve this problem at all. Nobody's pushing for this cross-party political meeting. As you stated, there should have been one at the end of February. And I believe that to date, there's still not a date for that meeting to take place.
I mean, it's absolutely ridiculous because you're right. Unless social care is sorted out, everything lands back in the NHS. Now,
Yes.
The other problem we've got here is we have an increasingly, and in fact, many ways, we are the victim of our own success. So our medical interventions keep people alive longer. As a result of that, we need more social care. And yet, if we don't deal with social care, nothing will ever change. And so that's why we're then seeing the bed blocking. Even if I go back, well, I trained, when did I qualify? 93. We had problems back in 1993 trying to discharge people out of hospital. And I used to do ward rounds every morning, trying to find people who were fit enough to go home, but there wasn't the social care provision. Even if they were fit enough to go home, I couldn't get them out of the hospital because they didn't have slippers or anywhere warm to go or food available or whatever it was. And so therefore you got into that situation where those beds were blocked.
That's why many care homes and indeed community care does have vacancies to be able to take those people out of hospital. But the systems and processes that have to go to take people out of hospital into social care are just phenomenal, and so many hurdles that it does take much longer to, especially people who are needed funding care. To be able to get funding care, there's so many blocks to that. And of course, the funded care, the fees that care providers get are just ridiculously low.
Of course they are. And that was the other thing I was going to say, was that actually caring for someone is such an important thing to do in life, and yet we pay carers appallingly.
Oh, yes, absolutely. We don't value them, we don't pay them. We expect them to be highly trained, highly skilled. We expect them to take every responsibility for looking after the most vulnerable of society, and yet we pay them the minimum wage. And so this has hit us. And because of the pressures to providers on the finance side, because at the moment local authorities only seem to be giving an uplift of say 4 and 5%, and yet this year with the minimum wage and the national insurance problems, we're facing more like 11-12% increase in costs, and that's on top of last year when we had over a 10% increase in minimum wage. And yet the local authorities were only giving that type of uplift last year. So it's not just this year, it's been a compounded year upon year problem. And we do have to remember people in community care who are providing community care, their margins are just so narrow on the costs of giving that care, even at these low rates, to the funding that they get in. It is unsustainable.
So can I just ask, but sorry, because time is time, what is the answer here? Is it to provide more social care? Is it, and I think it was under the previous Conservative administration saying there would be a lifetime cap on the amount of social care? Is it that you need just more money? I mean, you must have talked about this a great deal because you are also part of Providers Unite, this grassroots coalition uniting all the community care and support providers. In your wildest dreams, do you see a solution in any sense?
I think that, for one thing, social care needs valuing. we're looking after the most vulnerable of society, and yet we're not valued. The second thing is, if we can work closer with the NHS, money is always piling into the NHS and let the problems not being solved there. Social care is the solution. So appreciate social care, put parity of wages with the NHS.
Yeah.
And that way we will be able to solve this massive problem and not have quite so many people who are desperate for care and simply can't get it.
Well, it's been a great pleasure to talk to you. Thank you very much. I wish you a very happy Easter as well. That's Joyce Pinfield, their Vice Chair of the National Carer Association.